Today I'll just share an interesting case. Person, young boy, 19 years of age, complaining of the spacing developing in the front teeth. Here, he says the teeth are protruding, coming out. But he said, I have already got the orthodontic treatment done about 4 years back, and now they are protruding. And then he says one tooth broke here, so this is capped already. This is capped. Then you can see the cap. Okay. Veneer something they have placed. So, and then he was complaining of some TMD symptoms, temporomandibular joint related problems like migraine and all, but he was complaining of little headaches. So young chap, and says some problem he cannot. He says, I'm not able to find a good bite. Something happens which is not comfortable. He's not able to explain. So we thought of doing full bite analysis. What we did, and we done here 3D scan first. We saw center line shifted. Okay. So we saw center line shifted. This is the upper center, this is the lower. So, since we do restorative balancing and alignment together, we do bite balancing. So we have a set protocol that our aim is to give a mutually protected occlusion. So we first do a scan, then we do a scan. And scan we found that some edges are broken. This young age, 19 years of age, the teeth should not be bone and should not be broken. So we saw some canine tips gone, which is the earliest indication, and edges of central incisor broken or bone. Rest behind teeth are quite okay. But only thing is upper one tooth broke, he says, and we saw the incidental finding is that there is indentation on the teeth. The indentation on the upper incisal edges means there is unequal pressure on the front teeth, and he says the space is opening. You can see the space opening here. Now, and the canine tip is gone. So, occlusal finding are these. So, we thought of doing a bite analysis. We did a bite analysis, and after the bite analysis, we saw the bite is this much. This is a centric bite. Okay, the centric bite. What you said, this is a class 2 on the left side also. And the most problematic thing is that the lower centrals are behind the cingulum of the upper. So this is the most complicated thing to treat. When the lower teeth are behind in the centric occlusion, when the lower teeth are behind the upper, because the anterior guidance is very difficult to get in those cases. Because ultimate aim is to get a canine guidance, anterior guidance, and to give a balanced occlusion. Now it is very difficult to give it because this is, now if you see this centric bite and if you see this bite, this is already got a treatment done. At 19 years, it's almost touching the palate. What will happen? It's touching the palate at 19 years from behind. So there is no place to go. The upper teeth should not touch the palate. The upper teeth, there should be some space. The upper teeth should be seen like this. But they are already touching the palate at 19. So they want to collapse. So that's why it is pushing and opening. So it is causing spacing between the front teeth. Because it is bite is collapsing. So it is hit, slide and collapse. Yes. So we did a bite analysis. Then we saw one anterior section also. In this we remove the posterior section and we see the anterior relation. Specifically, we remove the posterior section. Why? Because if at all there is interference in the posterior section, we remove the posterior section only in the bite and then see the relationship between the upper and lower. So this is the relationship between the upper and lower after removing the bite. Okay. After removing the interference, this is the place where it is coming. Before removing the interference, this must be the space. After removing the interference, this is less space, but it is going to the palate. It is touching the palate here. This is the palate portion. Okay. So, if it is touching the palate, means how much I need a guidance, because I need these edges to be on the cingulum area, but it is very difficult because now I cannot slide the jaw. So it has to be a restorative alignment. Very difficult to get it, but we'll try. Because ultimate aim is that we need teeth. This is the upper tooth. This is the upper tooth here. If the lower tooth is here, it is very difficult to get the guidance. We need upper teeth and near the cingulum so that the teeth guide when the jaw and mandible moves. This much upper. The teeth are here. This is not good, very good thing. So we planned this mutually protected occlusion, and when this partially worn, because some teeth are worn, symptomatic. So we have to do, whenever the case is like this, then we plan in our protocol. We plan whenever we see a case like this, we go for a mutually protective occlusion in which we have fixed protocol of this. Our ultimate aim is mutually protected occlusion. So in this case, this is a small flowchart I have made. We want equilibration in all the teeth. That means all the teeth should touch each other. So we want to create a mutually protected occlusion, which is a balanced occlusion. So in the 3D scan, we see first category of patient, that is worn teeth or non, or partially worn. So young age, it will be partially worn. Some symptoms of TMD are there, temperamental but joint disorders. So we had given intervention therapy, deprogrammer was given, and we took a centered bite, Facebook record, and then ultimate aim is to give this balanced occlusion, which is a bite analysis based, because we cannot do simply alignment. He has already got a simply alignment done, which was done at current occlusion, MIP, but it resulted in failure of this. So what we want is mutually protective occlusion, and the process is whenever you see a worn teeth, it will go like this. Worn teeth, symptomatic, deprogrammer, balance occlusion, bite analysis, and restorative alignment. Restorative alignment means we have to restore those worn teeth and give a canine and anterior guidance. So canine anterior guidance in young age we can do by little alignment and restoration to prevent it from further collapse, because we have to create the guidance, anterior guidance. So without restoration of worn teeth, upper is indented, remember, and the canine tips are gone. So we have to create the canine tips and prevent the bite from further collapsing. Last time we got an alignment done, but there was no restoration. So there is a concept of restorative alignment, in which partially worn or worn teeth have to be restored. Means if they are worn like this, the tips of the canine are worn, front teeth, there is no guidance, they slide. You have to create the tip to stop the slide. So in this case we have to do mutual protection, worn teeth, symptomatic, deprogrammer, balance occlusion is the aim. Did a bite analysis to know how much imbalance was there, and we have planned a restorative alignment. We cannot do simple alignment. We cannot do treatment at current occlusion, because current occlusion is MIP. With simple aligners, you cannot do simple aligners. Treat them at current occlusion. We have to remember that we have to do alignment and balancing both. So for this is the flow chart of the treatment. This flow chart is for all the patients. It can be combination of anything, but for this patient is this way. And no treatment at current occlusion. If the patient would have been non-symptomatic at 19 years age, the treatment would have been non-symptomatic balance occlusion. Still, we would not have gone for at current occlusion. The current occlusion will create further sometimes TMD, and the teeth keep varying. So we have to do plan ultimately to balance occlusion, which is mutually protected, and we have to do bite analysis, which is phase bone centric.